Plan for universal health care in California is moving forward. Last week, the Senate committee voted to send the measure to the next committee. The proposal will eliminate private health care insurance companies and guarantee coverage for everybody in the state. However, critics say the measure would disrupt health care, require higher taxes, and create longer waits to see a doctor. And we say higher taxes. Wait till you hear how much. With us, with more on the bill and what it means for Californians, is Craig Gussin of Auerbach and Gussin Insurance. Good morning to you.
Good morning, David.
When I read the numbers on this thing, it's like, who could possibly consider this? The numbers that it would cost, right in front of me, $125 to $175 billion to pay for this bill, and that's just starters.
That's starters, and the numbers I'm hearing are probably closer to $180 to $350 billion. To break it down, you're probably looking at every person in California would be spending in taxes a month, $1,000 per person. So you figure a month. So a family of four, you're looking at about $4,000 a month in taxes to pay for this.
Okay, let's back up.
Okay.
What are they trying to do, and what exactly would this do?
Currently, 94% of the people in California have some kind of health insurance. Individual health insurance, insurance through their employer, Medicare, or other state government plans.
Okay.
Because 6% of the population has no health insurance, they want to make sure every person in California has health insurance.
So we're talking 6% that don't have it.
6% don't have it. And I get that we want everybody to have health insurance, but not at a cost of this kind of money. This is a job loser. People are going to leave the state. Employers like myself are going to lay off employees if we got to start paying taxes like this.
Yeah, talk about that as an employer. How much would this affect just the average small business?
The chamber testified last week at this bill, and they said that 10 years ago they were estimating that payroll tax would go up 16%. I'm assuming 10 years later it's got to be at least 20%.
Just for this one bill, this universal health care.
And again, what it takes over is your medical insurance, your dental, your vision, long-term care insurance, and also workman's comp insurance. Now, to me, one of the biggest killers of that is the long-term care insurance. I had a mother-in-law on assisted living. Her bill was $5,000 a month. If they got to now support that, where it's going to come from? They don't have the money to pay for it. You know, we just saw an article that you guys were a story you was doing about teachers being laid off because there's no money. But yet we're going to turn around and spend all this money for health care for about 6% of the population.
You were at this in Sacramento?
I wasn't, but it was actually live on
so you were
stream. I got to be able to watch it.
Kaiser had interesting comments about this.
Yes, Kaiser had some great comments. Kaiser said based on the way the bill is designed, they would be out of business. Out of business. And that 1 million people who are on Medicare through Kaiser would not be able to use Kaiser anymore. And that's a big thing. People love Medicare. This bill is being proposed as Medicare for all. But it really isn't, because Medicare is a government plan run by insurance companies. This is more like Medicaid or Medi-Cal for all, because this is government run. They're going to make all the decisions. They're going to appoint a board to make all the decisions. And it's all going to be based on the labor unions are going to be there. The one organization that's supporting this is the Nurses Association. They're going to be on this board. They're going to be picks from the governor. What people don't understand is the reason the hospitals and the doctors are against it, besides being a job killer, is that they know that they're going to end up having to get paid less and less money, which means we're going to have less nurses, less everything when you need it more.
Okay, we saw the gas tax go through.
Exactly.
I mean, and we seemed helpless to stop it.
Exactly.
Could this happen?
You know, one of the things even the Democrats said at this hearing was they all had a concern about the cost of it. There's an analyzation going on right now from a company in Massachusetts to say what the exact cost they expect it to be. I already know whatever number they come, it's going to probably be higher based on past history. Governor Brown is very leery from what I've heard of him signing it because of the cost. And you got to understand when you put it in perspective, Covered California has been the best exchange in the country. We've done it right. 6% unemployment, I bet you 5% of those people chose not to have health insurance because they don't want to pay for it. But yet now they're going to be forced to pay $1,000 a month towards this when they weren't willing to pay a couple $100 a month for it.
But they're upset with what could happen in Washington.
Yes, it's all based on what could happen in Washington, but we're a state-run plan.
Right.
We're not affected by Washington unless they take away the money. And from the last couple of days and weeks I've heard, nothing's happening right now.
Okay, Craig, we'll wait and see.
I'll probably see you soon.
Okay, I'm sure you will. All right, a group of local